Before viewing video lessons, it is important to read the textbook using the learning guide as your turn-by-turn directions. Then use the learning guide to take organized notes in your own words with examples and pictures.
This particular unit, this particular learning guide, melds two different chapters. Chapter 7, not all of it, because we already covered part of it, and Chapter 5, just the somatic related disorders. So the first set of this learning guide is really primarily coming from Chapter 7. And some of this is a repeat or a building on of things that we covered in the first unit. One of the things that we know in that great biopsychosocial model is that all of those factors are interacting, right? Your psychology, your behaviors, your thoughts, feelings, and actions are a result of an interaction of those factors. So psychological disorders or dysfunction is going to be related to an interaction of those factors, right? Turns out physical health is also a result of an interaction between biological, psychological, and socio-environmental factors. Health and wellness, whether you're talking physical or psychological, is a result of these interacting factors. Now, this is something that in the great history of understanding health and wellness, we haven't always understood. So we used to think of the mind and the body as separated, right? And things were either physical or they were psychological. And today we know that that's a sort of an artificial way of looking at the world. We know that things are interacting. So throughout this semester, we're going to be focusing on this biopsychosocial interaction as it relates to disorders with psychological symptoms, which is really what the DSM-5 is about. It's about a set of disorders that have cognitive, behavioral, emotional, and social symptoms, right? There's a biological piece to all of them. There's also a psychosocial piece too. So we're going to start out, though, instead of focusing on those, we're going to focus a little bit on physical health and physical disorders. Because one of the big questions people have is, well, is it in your head or is it in your body? We still think that when people display signs and symptoms. I want you to try to get away from that because the answer is yes for everything. Everything that could be wrong with you, physically or psychologically, is both in the mind and the body. There's an interaction of all those things. Now, there's two fields of study and practice that specifically apply to this interaction. So one is called behavioral medicine. Behavioral medicine does not just involve physicians, but it's a multidisciplinary field. So it has physicians, it also has psychologists and nurses and social workers. It has lots of different professions. And what these medicine specialists do is they take what we know from behavioral science, from psychological science, and they help to understand physical and mental illness, right? They don't separate those two. So they try to see how can psychology help us understand the cause, the treatment, to prevent the development of physical and mental illness. Now, within behavioral medicine is a subfield of psychologists. So the psychologists that work in behavioral medicine are called health psychologists. And you may find health psychologists working in hospitals, working in primary medical care clinics. And so I've done some work in health psychology. So I worked in a medical hospital. I worked with patients who had chronic pain. We had a biofeedback unit for people who had sexual dysfunctions related to pain. A sleep clinic. Lots of pain. Lots of pain. I'm going through all the pain. There was a lot of pain. We had a whole pain clinic that I worked with. But I also worked in primary care. So just when you go to the doctor for the sniffles and the twisted ankle and what's this weird rash, the next door over sat I. And I was working with people that came in to see their primary care doctor right there in the clinic in the medical setting. That is not the norm everywhere right now, but it's something that would benefit all of us if we had more of an emphasis on behavioral medicine. The reason is a lot of what ails us is psychological and social factor related. It is estimated that 75 to 90% of all visits to your primary care doctor are for stress-related problems. Stress is why your immune system is not functioning well and why you keep getting sick. Stress is why that cold that passed through the rest of your family without really touching them has you laid up and dysfunctional. So stress is one of those really big psychosocial factors. But we also know that people who are having relationship problems have increased susceptibility to illness, disease, and even death. We know that behaviors, patterns of behavior can make you sick. What kinds of behaviors do people engage in that hurt their physical health? So that's a great example, and I'm going to kind of take that example and apply it specifically to pain. So when you have an acute pain, you twist your ankle, right? What does the pain tell me to do? Sit down, dummy, stop looking on this thing. Pop that baby up. And that's effective for a temporary acute type of pain. What we find, though, is that people who have chronic pain conditions, the lack of activity, doing what comes natural when you feel pain, which is to stop, actually exacerbates the pain and makes the pain worse. Part of it is that you're there and you can only focus on that pain, but part of it is the lack of activity actually physically increases the amount of pain that you're experiencing. And that movement, not every kind of movement, but the right kind of movement, can actually reduce that pain. So what we know is that these lifestyles and behavioral patterns, all those things we just mentioned, coupled with stress, is what is actually killing us. The cause of death on the death certificate may say cardiovascular disease was the cause of death, cancer was the cause of death, infection was the cause of death. But why did they have that infection? Why did that infection get so out of control? Why did they develop cardiovascular disease? There are certainly genetic risk factors at play here, right? That would be a biological factor. But we know that those biological factors are going to interact with these psychosocial environmental factors. So I could have an identical twin. We could have the exact same genetic risk factors for cancer. I drink heavily. She doesn't. I'm going to get cancer. We know that alcohol is one of the direct causes of cancer. So she doesn't drink. I do. We have the same genetic profile. I get cancer and die, right? So this is a field that's really important. Stress is one of those big factors. So you guys should remember this from before the last test. When we were talking about the stress response, what happens when you have chronic stress is your amygdala is continually perceiving threats. Tiger, 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 all the time. Paper due, bill due, Dad's mad at me. You know, you got all this stuff constantly triggering the amygdala. That triggers the hypothalamus. That triggers, there's two separate processes. They're going to keep me pickled in stress hormones. They interfere with the functioning of the immune system, and they directly damage our tissues on a cellular level. So when you're chronically stressing, I have to make that stop, sorry. When you're chronically stressing, you are killing your cells and interfering with your body's ability to fight and repair and deal with the damage that you're doing. So we know that stress is a big factor. The lifestyle behavior patterns, I think you guys hit on some of the biggies. Hand washing is a behavior. We're very acutely aware of hand washing right now. Before COVID, I used to say, next time you go to the bathroom in a public restroom, just observe how many people wash their hands and how well they wash them. I've actually been casually observing this a little bit when I've been in the bathroom, and people are still not washing their hands very well, right? They're not using the alcohol wipes on the computers. They're not using the hand sanitizer. And so that's a behavior that could kill you if there's an infection, right? Another thing, and this kind of gets to what you were mentioning, Eric, which is impulsive behavior and risk-taking. There's also failure to take precautions. So I should probably add to this mask wearing, right? This is something kind of new, that mask wearing is a preventative behavior you can do to try to protect your health. Wearing your seatbelt. Seatbelt use is a great example of where psychology helped to study people's behavior. And since psychology started working with safety experts and automobile manufacturers, seatbelt use has gone up. It used to be very low. Now, there's still a ton of people who don't wear them, but relative to where it used to be, it's gone up. But yeah, there's all kinds of things, behaviors that we can do that can protect our physical health. So we know that these patterns of behavior put people at risk. And about half of the cause of some of these disorders, like sexually transmitted diseases, cancer, and cardiovascular disease, is behavior, right? So unprotected sex. Protected sex doesn't protect you 100%, but it certainly cuts down heavily on the rate of infection.
Like mask wearing.
Like mask wearing, yeah. It's not 100%, but let's bend that curve down. Yeah, yeah. But it's the same kind of thing. So patterns of behavior are specifically putting it at risk for infections, cancer, and heart disease. Stress seems to play a major role in disorders associated with chronic pain or chronic fatigue syndrome. And so these are conditions, particularly chronic fatigue syndrome, that are not yet well understood, but we think are related to an infection. So almost all cases of chronic fatigue syndrome, fibromyalgia, and other related conditions start out with an infection. In fact, COVID-19 could be a trigger for these types of conditions. There's a group of people that are called COVID-19 long haulers who have the disorder and they recover in the sense that they're no longer actively fighting the infection, but they have continued fatigue, cognitive disruptions, other manifestations of some kind of response in the body. And it's probably something happened with the immune system in response to that infection. So we think that may be happening here. So stress, which specifically alters the function of the immune system, is likely to worsen those types of conditions. So I want to talk for a minute about how the DSM-5 sort of handles this mind-body relationship. So you're going to see a lot of slides in class that look like this. One side will say DSM-4 and it'll be gray. It won't be on the test. The other side will say DSM-5. It'll be in black font. That's what I want you to know. I like to show this because in the US, we're still in a transition of how we used to do things with the DSM-4 to how we do things with the DSM-5. So in the DSM-4, we used to have this multi-axis system where most psychological things went on one axis, personality disorders and mental retardation went on a second axis, and in the third axis, you marked all their physical health problems. And it was nice because it was acknowledging that both existed, physical and mental, but it kept that duality of thinking. It kept that separation of thinking. The DSM-5 did away with that. They threw out this multi-axis system. They said all diagnoses should be diagnosed and coded and sort of equally. There shouldn't be this tiered system that separates things. And so this is part of the DSM's attempt to really help to dispel this mind-body myth that we have. Now, within the DSM-5 is a diagnosis. It is called Psychological Factors Affecting Other Medical Conditions. So what this diagnosis is essentially the person has something going on psychologically. It could be a diagnosed condition like anxiety or depression or a sleep disorder, or it could be simply a symptom, a psychological symptom that makes a medical issue worse. So if I have asthma and I have anxiety, the anxiety can actually make the asthma worse, right? If I have diabetes, poor stress management can make the diabetes worse. So we actually have a diagnosis now. This particular one is in the somatic symptom and related disorder chapter that allows us to kind of document this in somebody's medical chart. That, yeah, they have diabetes, but it is worsened by, it is complicated by this psychological factor. And that psychological factor is increasing the suffering, increasing the disability, increasing the risk of death associated with that physical condition. So it acknowledges the physical and the psychological and the interaction and relationships between those two things. Unfortunately, DSM-5 came out in 2013. We haven't seen enough medical people embrace and acknowledge this. So this is something that the mental health people kind of know about and we're aware of. If you're a behavioral medicine specialist and you have specialized training and you have a kind of a view of medicine that's more this biopsychosocial view, then yeah, you've embraced it. But most doctors were trained yesterday. They were trained under the old system. They do things the old way. And so we don't see this documented enough. Even if the doctor knows, like if you had a conversation with the doctor, they'd be like, oh yeah, their anxiety certainly makes it worse. They don't put it in the chart. They're not documenting it. And we know that diagnosis can influence access to treatment, right? So we want to make sure we're documenting this as much as possible. Now, the other way this gets acknowledged, and this one is throughout the DSM, is we have a diagnosis of mental signs and symptoms due to medical conditions. They have some kind of mental health symptom, a psychotic symptom, a bipolar, which would be a mood swings of highs and lows, depression, anxiety, obsessive compulsive thoughts and behaviors, or delirium, unclear thinking. And it's directly caused by something that we would think of as a physical medical condition. So someone shows up in the ER and they're confused. They're delirious. Their cognitive functioning is impaired. They're not thinking straight. They're not talking clearly. It's a psychological symptom, right? It could be due solely to a physical cause. Could be a seizure, could be a drug, could be an autoimmune, could be a nutritional deficit. There's 1,000 different possible. Could have been a head injury, right? So we have some diagnoses with cognitive impairment that are in the DSM because they're part of that mix of biopsychosocial kind of smushed together. And then we have some where it's like, no, there is clearly for this a lone biological cause, right? They got smacked in the head, right? And that's really what the cause is. But we want to acknowledge the mental symptom. So we have this diagnosis now that says, here's the mental symptom. It's a cognitive symptom. It's an emotional symptom. It's a behavioral symptom that's due exclusively to the most common would be a neurological injury or disease, a head injury, for example, a disease that attacks the brain. Seizures are also neurological in nature, so seizure disorders fit in there. Endocrine system dysfunction. Can hormones influence our behavior, our emotions, and our thoughts, right? So if your endocrine system has an issue, if your adrenal gland is doing something weird, if your thyroid gland is doing something weird, then that can cause some of these mental symptoms. Autoimmune diseases. Talked a lot today about how the immune system is really important for both physical and mental health. So if the autoimmune system is attacking behavioral or emotional centers, cognitive centers in the brain, that can cause a problem. Infections, right? Remember the first infection that we figured out causes a psychological disorder was syphilis. Sexually transmitted diseases, unfortunately, kind of like the brain. So HIV and syphilis are two big ones that we're worried about when it comes to the brain. And then the last one is digestive disorders and lack of nutrients. So if you have a digestive disorder and the nutrients are not getting in, or you're not eating properly and the nutrients aren't getting in, it can mess with your thoughts, your feelings, and your actions. In fact, sometimes older adults start to get fuzzy cognitively, and we think it's Alzheimer's. In some cases, it's actually a B vitamin deficiency. And we can correct their diet, we can give them B12 shots, and their cognitive functioning will return to normal because it's not Alzheimer's disease, which is a very specific disease process in the brain, even though it may look the same way when people come in. That you can actually have both a mental and a physical health problem at the same time, right? So I could have Alzheimer's disease that's attacking my brain and also not be eating well and have a vitamin deficiency that's actually complicating things and making it worse, right? So you could have two of these things overlapping. And so it becomes very complicated to tease out which symptoms are due to the plaques in the brain and which symptoms are due to the B12. Well, they're both. They're feeding off of each other. They're complicating each other. Treating the B12 will not make the Alzheimer's go away, but it would increase that person's ability to function cognitively within that narrow sort of ability that the Alzheimer's has limited them to.